Hi everyone, it's Kristen. I'm back with the Regional Assessment 5. This one's going to focus a little bit on our lower extremities as well as a neurological exam. So I'll start every exam with introducing myself to the patient. My name is Kristen. I am an advanced practice nurse that's going to be performing your assessment today. Can I please get your name and birthday?
Todd Smith, August 25th, 1956.
Perfect. And ideally, with any exam, I would like to be kind of maintaining eye contact and at eye level. Although I don't have a perfect exam setup. There'll be a lot of movements and a lot of things that I'm trying to help simulate an actual exam room. So bear with me, and there will be plenty of movement throughout this exam. If anything's bothering you at all, please let me know, okay? If anything hurts or if anything's making you too tired, we can always pause, take breaks, catch our breath, kind of thing. Might be a busy exam.
Sounds good.
Okay. So we kind of just start with everything, all of our assessments. I like to just look at a general inspection. So just going to be taking a look at his lower extremities. So I'm looking for symmetry, even skin tone, making sure there's no lesions, no abnormalities. So at first glance, legs are symmetric. I don't see any abnormalities. Hair is evenly distributed, which can be a good indicator of actual blood flow and good circulation. No masses, no obvious edema. Upon inspection, lower extremities are within normal limit. And like I said, even hair does indicate good circulation. So all within normal limits upon our initial inspection. Now we'll move into palpation of pulses, as well as temperature of the extremities. And then I mentioned inspecting edema, but I can also palpate for edema as well. So I will be palpating his popliteal, posterior tibial, dorsalis pedis pulses, and then I will check for temperature and for any pre-tibial edema. So we'll start with that. Start with popliteal, just kind of behind your knees. So these are even and 2+ bilaterally. Move on to posterior tibial. So 2+, not bounding, not thready. And then our dorsalis pedis on the top of that foot. Also 2+, equal bilaterally. Perfect. And then temperature, I have assessed to be warm. I did not palpate any pretibial edema, which would be kind of right on our shin bone, and not palpating anything bothering me when I'm palpating. So no concerns there. All of our pulses are 2+ bilaterally, and so within normal limits upon that part of our assessment. So now we will move on to inspecting our patient's toes. So I'll have him fan his toes out. I'll be inspecting in between our toes to look for any skin breakdown, evidence of fungal infection or lesions. So hopefully we're okay in that department. So I'll have you, if comfortable, fan out your toes. So skin is intact on both feet. Like I said, no indication of any abnormalities. Everything is within normal limits upon that assessment. I don't see any open areas or wounds or any concerns. Skin color, again, is even on bilaterally, so no concerns with our inspection of our toes, because that can actually tell us quite a lot about a person's overall health. So now I'm going to check his range of motion and strength. So I will check his hips, and this will be our lower extremities again, our hips, knees, ankles, and feet. So every time I kind of have you do a movement, I'm just going to have you push against or kind of pull against my hand. So I'll indicate which one you're going to end up doing. So for this, I'm going to have you move to this chair, I think would be best. And I'll just kind of adjust the camera. So we will first I'll have you push up against my hands for this. Perfect. And I'll have you pull down. Awesome. And then we push up. And then we pull back against my hands. Perfect. And then I'll have you push your ankles up. Perfect. And push down. Awesome. And then for your hips, I'm going to have you kind of push or try to spread out your legs against my hands. Perfect. And then pull them together. Awesome. Great. And then I'm just going to have you go ahead and let those feet relax and kind of rotate your feet in and out, your ankles in and out. Any difficulty, any pain with that movement. And I'm going to have you kind of swing your right leg out, swing your left leg out. Then I'm going to have you kind of lift your hip or your leg up in that chair. Yep, in there. Any pain with that movement?
No.
Perfect. So our strength is 5 out of 5 bilaterally. Full range of motion without pain in the lower extremities. So I'm also next. As I mentioned, this is trying to simulate an exam room, so I'm doing my best, but I'm going to kind of observe how he is able to move from a lying position to a seated position to kind of assess that strength. So Todd, I'm going to have you lay back down on this couch if you're comfortable with that.
Sure.
And I'm going to assess how you're able to sit up from a lying position. So I'm going to have you, in just a moment, have you sit up and then kind of turn your legs as though you would be sitting on the edge of this couch or this exam table. So can I have you sit up? Perfect. And then kind of move as though you would be getting off of the exam table. Perfect. Did anything bother you with that? Any pain?
No.
Any difficulty?
No.
Perfect. So he moves independently, no weakness, no instability noted. So that exam, that moving from the lying position to the seated position is within normal limits. So we'll kind of move now into our neurological assessment. So we are going to be testing superficial pain and light touch. I'm going to test sensation using light touch and sharp and dull stimulus. So I'll have you tell me where you're feeling it. So what body part you can say, maybe my foot, my hand, my arm. And if it's soft, you can say dull, or if it's sharp. And for this, I have the end of like a cotton tip for the soft, and so I'll let you kind of feel it ahead of time. And then the end of this pointy, I don't know what you would call it, a little stylus would be our hard, our sharp. So I'm going to have you move right back into this chair just so we can get a better look at it. And once again, I'll have you just tell me the location, and then if you're feeling, you can say dull, you can say sharp. Okay. So just before we start, this is what that soft feels like, and this is what the sharp feels like.
Okay.
Is that okay? Okay. Yeah. So now if you close your eyes, and I'll just move through parts of your body, and you tell me, again, location, and then sharp or dull.
Left hand, dull.
So that was soft, yes, that was dull. So that was perfect. Sorry, yes, I made a mistake. That was great. You passed my test. So now we will move on to our next one. So keep your eyes closed.
It's right arm, sharp.
Perfect.
Left arm, dull.
Awesome.
Right hand, sharp.
Perfect.
Left foot, sharp.
Awesome.
Right foot, dull.
Perfect. You did wonderfully. I made an error with that first one, but he was correct. So he is able to correctly identify sensation in his legs, feet, even in our hands and our arms. So he is within normal limits for that superficial pain and light touch. So now we are going to kind of just test his position sense. So I'm going to have you, I'm going to be moving your finger up or down, so you just kind of tell me in which direction I'm moving it. So I'm going to have you close your eyes and kind of hold your hands out.
Okay.
And I'll just do your right hand so you can relax this one. So you can just tell me if it's up or down, okay?
Down. Up. Up.
Perfect. So he is able to correctly sense position. He is able to distinguish the direction correctly every single time I moved his fingers. So now I will be placing, and this is just going to test if he's familiar with different objects. And this is our just assessment of familiar objects. And we'll start with a coin, a paper clip. I'm trying to think what else I have that would be familiar, and a pen. So I'll be placing these familiar objects in his hand, and he will hopefully correctly identify each one with his eyes closed. So I'm going to have you hold out your hands. You can just kind of tell me what you think you're feeling.
Paperclip.
Perfect.
Pen.
Perfect.
Paperclip. Coin. Coin.
Awesome. Okay, you can relax your hands and open your eyes. So we were able to correctly identify each object that I placed in his hand. And so now we'll move on to his cerebellar function. We'll start with our arms, then we'll move to our legs. So I'm going to have you touch your finger to your nose and then to my finger, okay?
Okay.
So I'm going to hold my finger out in front of you. I don't know if the camera can see this. Hold my finger out about a foot in front of you,
Okay.
and I'm going to have you touch your finger to my nose. You do it just a few more times for me. Perfect. Awesome. And we'll have you just maybe do our other hand as well, just to.
Okay.
Perfect. One more, maybe. Perfect. Awesome. So his target accuracy is within normal limits. He has smooth, coordinated movements, no tremor noted with that function test. Now we are going to move on to our legs, and so I'm going to have you slide your heel kind of from down to up your shin. So you'll start at the top. You can watch me kind of model it, but you'll start with your heel kind of towards your foot and slide it up your shin on that side. And then I have you move that opposite foot to the opposite shin, starting at the bottom and move it up. Does that make sense?
Mm-hmm.
Towards your knee? Okay. Can I have you do that on? I'm going to move it down on both sides. Perfect. And so again, smooth, coordinated movements with that cerebellar function test of his legs. So bilateral, smooth, and coordinated movements within normal limits for that exam. We'll now move on to our reflexes, our deep tenon reflexes. I've been trying to get a hold of a reflex hammer, but I'm going to have to simulate one with this remote. Hopefully it will do that exam justice, but yes, in a real clinical setting, in a perfect exam setting, I would have a reflex hammer. And I do know some physicians have actually used the end of their stethoscope, and they say it works similar. I also work with pediatrics, so that may be part of it. But we'll kind of be checking our deep tenon reflexes with our reflex hammer. So we will be checking our biceps, triceps, our patellar, Achilles, and then Babinski reflexes. So we can start with biceps. I'm going to kind of, every time I hold your arm, just let it relax, okay?
Okay.
So that's how we're going to best. So you can kind of let my arm hold yours, okay? Perfect. Move over here. Kind of let the arm relax. Perfect. And then for this arm, I'm going to hold. I'm going to hold it. Perfect. On that side. Ooh. Sorry, Charlie. Good dog. Perfect. And then I'm going to move the camera just to get down here. So we will go ahead and do our patellar, Achilles, and Babinski. So I'm going to let these legs just kind of dangle, okay? Check this out. Oh, so sorry. It's a little abrupt. Are you okay?
Yes.
Okay, great. We're good here. Perfect. And then we are going to check our Achilles. So again, just keeping that then I'm going to slide, and I hope this doesn't tickle too much because that is sometimes the common complaint. I'm going to slide this kind of from your heel to your toes and just watch your response on that. Oh yeah, I was like, I'm making sure that's perfect. So I'm going to move here. Perfect. Move here. Perfect. Awesome. So all of our deep tendon reflexes were 2+ and symmetrical. His Babinski, I'm going to move this up. Babinski was negative, so his toes flexed downward, which is actually a normal finding in adults. Now I'm just going to have you stand up for me, if you don't mind, just in front of that chair. And what I'm going to do is move this just out of the way of our exam for just a moment, and I'll have you kind of stand in the center here. So I'm going to inspect him for some varicose veins. So just taking a first glance at his legs, I see no bulging veins, no evidence of varicose veins. I'm just going to check posteriorly. Again, no bulging veins noted. No evidence of varicose veins upon standing. So we'll now check his musculoskeletal, kind of more of our gait and our balance. So I will have you, Mr. Smith, walk if you're comfortable. I'm going to have you change just the way you're walking. So you'll start on this side. You'll walk normally for the first. Then I'm going to have you walk heel to toe for that second time you're walking by. And then I'm going to have you walk on your toes, if you can do that. Some of these can be difficult. And then I'm going to have you walk on your heels. See how that goes. So I'll remind you and I'll cue you which one I'm going to have you do for me, just so I can assess your overall gait. So have you just again walk normally for me. Okay. Smooth and steady gait with that normal walk. I'm going to have you walk heel to toe. Let's see if I can get this. Perfect. Again, smooth and steady there. Now walk on your toes if that doesn't bother you too much. Perfect. And then can I have you walk on your heels, Charlie? So smooth and steady gait noted. He's able to perform all walking tasks without difficulty, and he's able to listen to direction with that. So I am going to now have you kind of stand again in the middle of this frame, if you're okay, and just to check, do you need any rest or any break throughout this? Because I know it's a long exam. It can be a lot of physically taxing.
Doing okay.
You're doing okay. Great. So I'm going to kind of just check the Romberg test. So I'm going to have you stand right here, and I'm going to have you stand with your hands by your side, and I'm going to have you close your eyes, okay? And I'm right here for safety, so hopefully you don't feel too unsteady, but I'm here just in case. Perfect. So minimal swaying. I honestly don't see any swaying. You're able to open your eyes again. No loss of balance with that Romberg test. And so now we'll just check kind of a shallow knee bend. So what I'm going to have you do is just bend each knee on this side, and then I'm also just going to have you slightly lift that knee to your chest on each side too. So I'll have you. Does that make sense? My movements. Yep. Perfect. Okay, did anything hurt or bother you through that? Okay. No. So smooth movements noted with that shallow knee bend. He's able to move and bend without any pain or instability. So now we'll move on to our spinal inspection and range of motion. So I'm going to have you kind of, and you can do this after I can kind of model it, and then I'll cue you again. So I'm going to have you bend forward and kind of try to touch your toes. I'm going to have you bend backwards. I'm going to have you do a twist and a twist. And I'm going to have you bend side and side. And then I am going to kind of just stand behind you just to kind of assess your movements and the fluidity. So have you bend down and touch your toes. Perfect. And then can I have you bend backwards towards me. Perfect. And then can I have you do a rotation to your right. And then a rotation to your left. And then can I have you put your hands on your hips? Can I have you lean to the right? Awesome. And then lean to that left side. Did anything bother you throughout those movements?
Nope.
Perfect. Sorry, my computer's dying. So our spinal range of motion he has full range of motion without pain, and then I noticed kind of from behind his spine is straight, so no abnormalities with that. So it'll kind of move us now into our motivational interview. So for now, I'll let you get a little bit more comfortable. Maybe sit here. That way you can rest a little bit, take advantage of the resting moments during this exam. So we'll start with motivational interviewing. And so I would honestly just like to talk about your activity level and kind of what types of physical activity do you enjoy or feel comfortable doing?
I like yoga and doing some workout stuff. I haven't really had time for it lately, but
Okay. And so it sounds like you're interested in being more active, but you're just struggling to find the time to do so. Is that correct?
Yeah, just work, busy schedule.
Okay. What would you think is maybe one change that you can make to incorporate a little more of that starting this week? So maybe one change that we can work towards this week?
I definitely have some free evenings, and I have some friends that are regulars at a yoga studio, so I could probably join them for that.
Perfect. And it sounds like you're already kind of aware of the changes that you need to make to better your health and to make more time, so you're on the right track with that. Mm-hmm. That's awesome. And then so we'll go ahead and move on to health promotion recommendations and teach back. And so I'll give a couple of recommendations based off of his initially reported age. And so the first one would be fall prevention. And so one recommendation for his age group is to maintain a lower body strength to reduce overall fall risk. So exercises like walking and light resistance training can help. So yeah, like I mentioned, for your age group, we want to lower our fall risk. And so exercises that are like light resistance as well as walking and light resistance training can help to reduce that overall risk. And so to implement teach back, I will say maybe just so I know I explained it clearly, can you tell me ways in which you feel as though you can reduce your overall fall risk at this age?
Yeah, sounds like movement's a big part of it, kind of like a use it or lose it deal. Make sure I'm keeping up my coordination and balance. A little bit of strength training will probably help with that too.
Awesome, you're on the right track with those responses. So I'm glad to hear that he, after utilizing Teach Back, he fully understood what I initially taught him. So now we'll move on to our second recommendation, which is cardiovascular health. And so another recommendation for his age group would be to aim for about 150 minutes of moderate exercises weekly to support heart health. And so kind of mirroring it to him, a good recommendation for your age group would be to incorporate about 150 minutes a week of moderate exercise to help promote our heart health, better our heart health. So to implement Teach Back, I would say, or maybe ask, how would you describe that weekly activity goal that we discussed to promote heart health?
Yeah, sounds like getting at least a few hours in of movement activity. It's good for my overall longevity, heart health, cardiovascular, all that good stuff.
Awesome. Again, with implementing and utilizing Teach Back, I'm able to understand his understanding and kind of meet him where it's needed. And so that ultimately concludes our Regional 5 assessment. Thank you for being such a great patient. I hope it wasn't too strenuous. And yeah, thank you.